when we think about the FDA, CDC, any sort of blanket guideline, I think that one-size-fits-all medicine is not a good strategy. I think that we need to make sure that, again, going back to the individual patient that's sitting in front of us and providing the safest, most effective management that we can when we're treating chronic pain. And so certainly we have guidelines there for a reason, to make sure that we have synthesis of the most up-to-date information, but guidelines are just that, a guideline. It's not a law, it's not a hard and fast rule. So again, making sure that there are ways for us to really advocate for the patient and advocate for the safest, most effective treatment. And so whether that's a low dose, whether that's a moderate dose, whether that's something that is considered a high dose, making sure that we have parameters in place to be able to treat our patients and individualize it as opposed to one size fits all. I'm lucky at my site to have a lot of interface with primary care providers, and so when we have these discussions on how we can best communicate opioid reduction, opioid tapers with our patients, we really go back to how can we draw out the patient's intrinsic motivation for medication change, lifestyle change, for functional change, and really taking a patient-centered approach and kind of figuring out motivation, confidence, and all of that, and kind of wrapping it up into a package of how can we work together to provide the safest and most effective pain care. So taking guide from our psychology colleagues and really encouraging our primary care providers to listen to patients to understand, as opposed to listening to formulate a response. And so that's something that we really encourage. And then also utilizing other practitioners on the team. So if it doesn't need to be done by a primary care provider, can we utilize other providers on the team to make sure that we're providing the most comprehensive care to, number one, support the patient, but number two, to support our primary care providers so that they don't feel that the weight of the world is on their shoulders.